details. The notion of a premium is we already have copays and cost sharing. So if you use services, even folks at low income share in a part of the copay for those services. This is different. This is paying a monthly premium to have access to coverage for folks who are above 100% of poverty. The actual premium amount will be very small, comparable to what's on the subsidized exchange, but actually probably even smaller. And John, I don't know if you can fill in any.
Give him a number. Give Ann a number, or approximate number.
Okay, so looking at the exchange plans, what the subsidized amounts are, they range anywhere from $15 to $22. And so what we're working on is a sliding scale for people between 100 and 138 to come up with an amount for that.
Let me also, question? Yeah, but let me also tell you, you know, I've traveled around the country now, and what we have found in Ohio is true nationally. This is part of what I've said to Cynthia and Doug. Our welfare systems are under very strident attack. Do you know that? To expand Medicaid, we had to go through a controlling board because people didn't want to vote on it. You know, the picture in our minds of surfboarders getting food stamps doesn't help the cause. So what we do know is that these reforms, we think, are critical to restoring fundamental public support across the board for the need to help somebody. So, Ann, the idea that you would pay, do a co-payment is designed to drive towards the sense of personal responsibility. It isn't a lot of money what they're being asked to put in there. And if they're below 100% of poverty, they don't put anything in there, okay? But it is my goal through these programs to restore legitimacy and strength to our social service network. And I tell you, I never cease to be amazed at some of the comments that I hear about social service safety net programs that some people would just like to eliminate. We're not for that. We're for strengthening those programs, but we have to strengthen them in such a way that it leads to work and independence, not dependence. So these approaches that we take are all designed to be part of a big package to communicate, particularly to members of our legislature and maybe perhaps the legislators and congressmen around the country, that these reforms are worth examining. Because nobody wants to not help somebody who needs help, but nobody wants to continue to help somebody who needs to learn how to help themselves. And that's the philosophy behind this. And I think it's a good one, and I think it can work.
Governor, some of the well-being